So I'm going to introduce our speaker for this afternoon, Patty Doister. She's from Uniformed Services University of Health Sciences, and she's always one of the most well-received speakers at this practicum because the work that she and her team does is so very important. So please welcome her.
Thank you, Reagan. It's always a pleasure to be here. Dr. Coates, great to be here. Thank you. This is one of the things that I enjoy every year as well. So I'm a federal employee. I have to disclose that I have no conflicts of interest, and everything that I say is my opinion, and it does not reflect the Department of Defense. So I think you all have the objectives, but really what I want to do today is go over some of the patterns of dietary supplement use in the military, identify some of the issues of concerns that we're thinking about, introduce some ongoing dietary supplement initiatives that are going on within the Department of Defense, and in particular where I am at the Uniformed Services University, and then introduce Operation Supplement Safety, which is the DoD initiative for educating our service members on dietary supplements. So a little bit about use of dietary supplements. There is a survey that's conducted every few years called the Survey of Health-Related Behaviors, and you can see in this slide how often it's been conducted. Well, in 2005, we were actually able to insert some questions in there about dietary supplements. And it really is to look at behaviors, and so certain dietary supplements is a behavior. So again, in 2005, we were able to insert questions on dietary supplements. And then again in 2011, we were able to insert questions. They were not launched in 2008. They have been launched in 2015, but the data are not yet available for public use or for public consumption. So these particular surveys are really large surveys of service members, and there's a cluster sample survey in 2005, and then in 2011 it went to a web-based survey. That was the first time it was web-based. 2015 it was also web-based. And so you can see that the return rates are not that great with a web-based survey. They were better with the paper survey. It was, paper. They would actually go to the sites and collect the data. So these are the questions on dietary supplements that we deployed for the 2005, and you can see all of the different things that we asked about categories because we were very limited in how many questions we could ask. So we talked about multivitamins and minerals, individual ones, antioxidants, bodybuilding, herbals, weight loss, joint health, performance enhancing, and then other. And then in 2011, you can see that that choice was narrowed somewhat, but we still had some of the same categories. And so the next slide is actually going to show you the percentage of the people within the Department of Defense who responded to this survey and how much they took of those particular categories. So you can see multivitamin, mineral, vitamin or mineral on the end. And this was at least once per month. And you can see that a large proportion of our population does take dietary supplements. Now this next slide is a little bit different because we're just looking at two categories of dietary supplements that were queried in both 2005 and 2011, and that was bodybuilding and weight loss. But please note that the y-axis is different here. This says taking supplements greater than 1 time per day. Before it was once a month, and now it's at least once or more times per day. And these percentages are of somewhat concern because, as we'll show, some of these products are classified by the FDA as of concern because they are often tainted or adulterated. So about 20% of the population, or about 15% of the population were taking bodybuilding, and about 12% were taking weight loss. That is not a trivial amount, especially if we know that there are potential concerns with these dietary supplements. Now, for herbal dietary supplements, this was the kind of the prevalence of them taking herbal supplements. And you can see it's quite interesting. They took it as a CAM or for nicotine dependence. And again, this was from the 2011 survey when herbal supplements were added. So there's still, quite a large number of people who were taking such products. Now there's another survey called the Status of Forces Survey, and this is actually deployed every year, unlike the Survey of Health-Related Behaviors, but they add different questions each year. And in the past couple of years, in 2005 2014 and in 2016, they also asked questions about dietary supplements. And so I'm going to show you some of the data from the 2014 Status of Forces survey. And in this one, they asked about bodybuilding, performance enhancing, weight loss, and herbals. And again, you can see the percentage of the population who self-reported taking such products. And again, these seem to be a little bit lower than the survey of health-related behaviors. There are different populations that are surveyed. These surveys are conducted by two completely independent groups, so that may be the reason. And also, perhaps it's a function of, again, who actually answers the surveys. But nonetheless, there's still a large percentage who are taking these products greater than or equal to once a day. It's different if you're only taking it once a month. Now, as I told you, that the survey of health-related behaviors and the status of forces survey, I actually have the data, but I'm not allowed to release it. But so next year when I come, I can add that to because right now I'm limited in what's actually available. So what are some of the concerns that we have about dietary supplements? So what are some of the issues? Well, and even though this was from 2010, I like to show this because it really sends a message. So there was a soldier who was deployed, and he went around and he looked, and he said that there's a lot of people are talking about over-medicating, but nobody's really looking at dietary supplements, and that maybe that's something that we need to do, because he says that there has been little attention focused on the sharp rise of supplements used by service members. And then he goes on to say that while the use of steroids by soldiers when deployed is rumored, the use of supplements to become bigger, stronger, and faster is a fact. And I think there's some of you in the audience who actually know that this is the case, that there are loads and loads of our service members who are taking multiple combinations of dietary supplements. And certainly, Dr. Hurley, the last talk was about interactions and some of the different ingredients that can interact with drugs, and those are of concern to us as well, because they're not only taking supplements, but they're also potentially taking drugs. So this picture just shows you what a service member brought into us that they were taking, and there are about 9 or 10 different products. So you can see that if you're taking all of these things at one time on a daily basis, the potential for an adverse event or for an interaction with a drug is really quite remarkable and a little bit scary if you ask me. So what are some of the other issues that we're concerned about? What we have found is that for the most part, service members and their families really don't understand the dietary supplement industry or what it really means. They assume that everything that they're purchasing is safe, so they don't really understand the nuances. And particularly on military installations, you can go to an exchange, you can go to the commissary, there's GNCs on base, there's other little stores on base. They all sell dietary supplements. And the general consensus when you survey them is that they usually, certainly 60 to 70% of them, believe that they're safe. So why would they not purchase them? They don't understand that there are possible complications. Some of the other concerns is that our active duty members are exposed to a lot of different environmental challenges, and they're exercising in the heat and at altitude. And so we're concerned about some of the ingredients that are in products. For example, there's a lot of different stimulants, and they're thermogenic, and so that could compromise all sorts of different systems when they're taking them, especially if they're taking them in combination. Stimulants is another ingredient or classification of ingredient that we're worried about, because there's so many different kinds of stimulants, and you can see up to 6, 7, or 8 different products in one ingredients in one particular product. So we're always concerned about the potential for adverse events. And our other concern is the adulteration, and we've done some work which will show as I move forward that there is quite a bit of contamination or adulteration. And certainly the FDA has their tainted supplements widget that shows what products are being removed from the market for being contaminated with prescription drugs and other ingredients of concern. The ones that we're very concerned about are what we call appearance and performance enhancing substances. And there was actually a workshop a couple of weeks ago on this to raise the public awareness that this is really a public health concern. certainly within the military, they want to be able to perform as well as they can. And so what we've got on this slide is kind of a list of some of the products that we consider appearance and performance enhancing substances. And you notice I'm not saying drugs, even though some of them are drugs. Some of them are kind of in a gray area, and some of them are actually dietary ingredients. So the anabolic androgenic agents we're very concerned about, and we'll go into that a little bit more. The prohormones, the DHE analogs, these are all ones that we're concerned about. Selective androgen receptor modulators, those are, and again, I'm going to show you some more as we move forward. Those are ones that we're very concerned about. And then more recently, the selective estrogen receptor modulators. These are all readily available for sale in dietary supplements. And it's of grave concern to us because we want to make sure that our service members are safe. A lot of the bodybuilding supplements are adulterated. Some of the other products that are coming on the market, well, that are on the market now that we're concerned about, and you can see them advertised, are some what we call the nootropics or the cognitive enhancers. And there's a lot of the different ingredients in there, the family of racetams, and all these other different ingredients that are being marketed, again, for cognitive enhancement. And then the weight loss supplements. We know that there's a number of them that are actually contain illegal ingredients, prescription ingredients. There aren't any weight loss supplements on the market right now that really will help you lose weight unless they have a hidden ingredient in them. I think that's kind of what we're seeing. So these are some of the other concerns that we have within the Department of Defense in terms of trying to keep our service members safe. So I mentioned that selective androgen receptor modulators was something that we're concerned about. And this was actually brought to our attention from the field. We get people from the special operations, from the infantry, from all the different groups, communities, whatever you want to call it, about products that they're seeing their service members taking. We got a call out. They said, hey, we're really concerned about this. And the SARMs are actually considered anabolic agents, but they are not anabolic steroids, so they don't fall under the Designer Steroid Control Act. So they are ingredients that are being sold either as a research tool or in dietary supplements. And there's nothing in the Department of Defense that says that we can't use them, and I think the FDA is struggling with some of these ingredients as well. They have not been proven for human use. There have been clinical trials on some of these ingredients, but there are none available as a drug at this moment in time. However, and what I'm going to show you is that they can easily be purchased online and as a dietary supplement or, again, as a research product. And then I've got some of the names listed there. You can see ostarine, andarine, carnadine, all of these different products, ingredients that are selective androgen receptor modulators, or SARMs as we call them. Interestingly, some people thought that they were kind of controlled under DASCA, but they're not. But the DEA said that's really a good thing because then maybe people won't buy them. But the DEA has come out and said that they are absolutely not controlled under that particular act. So they are not a controlled substance. So again, we mentioned the cognitive enhancers or the nootropics, and these are readily available on the market, and there again are some of the ingredients that you see in them. And the FDA has issued statements about them, but we haven't seen a lot of action in terms of removing them from the marketplace so that anybody could go and purchase them at this point in time. I know that they're trying to do some things, and they did send a warning letter out back in 2010, but it's still rampant throughout the internet and actually in stores as well. And this is just an example of one, Supplement Facts, and you can see phenylpiracetam. That is not a legal dietary ingredient, but nonetheless, it's on the market. So I talked about adverse events. We're very concerned about adverse events, and they really manifest themselves in a variety of ways. Some of them are cardiac, some of them are seizures, some of them are exertional rhabdo, exertional heat illness. And the products that are usually associated with them, there's no causal connection at this point in time. There's just associations. but with the nitric oxide products. And so these are always concerns to us. And then we're going to talk a little bit later about liver toxicity, acute kidney injury, all sorts of different events. Rhabdomyolysis, which is an exertion, in this particular case, exertional rhabdo, has been associated with an adverse event associated with certain dietary supplements, and usually they're stimulants that they're associated with. And within the Department of Defense, there have been really too many people who have died taking dietary supplements. They mentioned ephedra. I think actually it was the Department of Defense that removed ephedra from their marketplace before the FDA was able to take it off the market. And the same thing happened with dimethylamylamine, or DMAA. We were the ones who kind of took it out of the marketplace in our department before the FDA was able to rule on it. So we see it, and why do we see it? Because we have people who are challenged. They want to be as good as they can, and they'll take any shortcut that they possibly can so that they can perform the way they want to. One of Dr. Paul Coates' comment is that the military is the field laboratory for every dietary supplement, because they are out there and they find supplements that most people would never imagine were even available. And you're going to see some of those because we really get some great information from the field. This is a recent event. This was about 2 months ago. We got email from overseas, and they said that patient X had developed hyperbilirubinemia, and he had to be medevaced to Walter Reed Army National Military Medical Center here across the street. And patient Y was taking the same supplements, and he ended up on dialysis. Again, he was medevaced from theater, from being deployed to the hospital across the street. And the supplements that they were being taken was Trenovar and Epistane. Now, anybody who knows anything about anabolic steroids knows that just those names alone tell you that they are supposed to be for anabolic purposes. And they were produced by German pharmaceuticals. So these are the products. We actually were able to have them send the products over to us, and then we could have them analyzed. But they had supplement facts panels on them, so they were supposedly legal dietary supplements. When we had them analyzed, what we found was that there was a SARM, ostarine, in it, and then there was a testosterone, there was an analog of testosterone, so an anabolic steroid in one of them, and in the other one, it also had an anabolic steroid in quite high amounts, 22 milligrams, and also a SARM. So even though those weren't on the label, the SARMs weren't on the label, there were anabolic steroids in them, and those are the only possible explanations for the hepatic injury in these two particular soldiers. And the cost of, one, taking them out of their unit when they're deployed and having to send them back here and then spend months in the hospital is really compromises the readiness of our troops. And so that's one of the reasons we're so concerned about certain dietary supplements. So what are some of the research efforts that we have going on? Well, I want to talk a little bit about adverse event reporting because we've done a number of surveys now to physicians, and we're trying to reach some other healthcare providers as well, asking some simple questions. So as I said, we've done 4 studies so far. So we did physicians who had graduated from Uniformed Services University, and this was a couple of years ago. We did a survey of military physicians, not just USIS grads. We did a survey of sports medicine physicians that were civilian. It's the American Medical Society for Sports Medicine. And then we did a short survey of emergency medicine physicians. And we asked them the questions, had you ever seen an adverse event from a dietary supplement? Did you know how to report an adverse event? And did you report the adverse event? And I think that the data are really quite striking, because if you look at those who had observed an adverse event, over 60% of them had seen one. In fact, the emergency medicine docs had seen more than anyone, which you would actually expect that they might. But if you look at how many of them knew how to report an adverse event, it's really a little bit scary because less than 20% overall knew how to even report one. And of those, less than that even reported them. so that we know that the adverse events that we're seeing, with at least certainly within the Department of Defense, rarely go reported. In fact, they almost always go unreported, and we're working very hard to try to change that. So here's a little summary of that. So again, 60% of the military physicians had encountered it, but less than 1% had reported it to the FDA. Because when we asked them if they had reported it, we asked them where. And the where could have been, well, I told another doctor, or I reported it to the pharmacy, or I reported it to the preventive medicine unit, or they reported it somewhere. But less than 1% of those actually went to the FDA. So if you look at the civilian sports medicine, less than 4% had gone to the FDA. And in civilian emergency medicine physicians, less than 1%. And those were the ones who were really seeing it. And it was interesting when we tried to do our survey of emergency medicine physicians, we went to a number of emergency medicine associations and asked if we could deploy this questionnaire. And some of them said, well, no, because we don't want to look bad if we don't know anything. And I thought, isn't that sad? You have an opportunity to identify a gap and then educate your physicians so that you can actually increase reporting, and then we can take some of the bad apples off of the market, or the ingredients that are causing problems off the market. So adverse event reporting, this is still an interest of ours, and what we'd like to do is go and ask other healthcare providers, dietitian, occupational therapists, athletic trainers, physical therapists, nurses, the whole gamut of healthcare professionals, so that we can see where their gaps are. And we are trying to fill the gap in the military population to educate them how to report adverse events, but it is a challenge. I told you we had done some testing of dietary supplements. We have a partnership with the United States Anti-Doping Agency, USADA. And for the past number of years, we've been testing products, and we've tested 219 to date. Now, those 219 come from a variety of sources. For example, you saw that we tested the 2 from the soldiers who had had hepatic injury. So those are 2 of the 219. So it could have been because there was an adverse event. We obtained the product and then had it tested. It could have been a physician said, hey, so-and-so's taking this, he's not feeling very well, can you look into it? It could have been somebody who said, he popped positive on a drug test, can you analyze it and see whether there's anything there that would have caused that? So, or we had a soldier who told us they went into GNC and one of the agents actually gave them a product. And so we're testing that. So we get them from all different reasons. But we usually do a steroid test or a stimulant, and sometimes we do both. Now we're actually extending now to look at other products, some of the other botanicals and the like, so that's going to be in the future. But right now we've been testing primarily for steroids and stimulants. And what you can see down at the bottom of the results, of the products tested for steroids, 49% of them had anabolic steroids in them. And these are products sold as dietary supplements with a supplement fact panel. The percent of stimulants positive was almost 61%. Now, when I say positive there, it means that it had stimulants in there that were not on the label. Could have been other ones. It could have been, we tested some and they had methamphetamine in it. So there were multiple different stimulants that were in there that were not on the label. And I said we did a full athletic screen as well, where we did both steroids and stimulants, and of those, they were positive for both stimulants and steroid products, almost 30%. So this is alarming when you realize that this is what our DoD, our service members, are actually taking these products. So it's really a deep cause of concern for us. I talked about SARMs. We tested 27 dietary supplements were tested for SARMs. They had supplement facts panels on them. And you can see up here that 9 of the 27 contained SARMs, and the products or the ingredients identified were those that you can see. And one of them provided, it says 13 milligrams. Now, we have no idea what type of adverse event could could emerge when you're taking these particular ingredients. There's just no data out there. We don't have any clue. But this is very common. You can get this all of the time. So again, these are from some of our testing program. Here is another product that we tested. And again, this one we heard about from our Ask the Expert. Somebody wrote in about this particular product. And so we analyzed it. And that's what it actually has on the label. And we tested it. We found all sorts of things. And if you follow me here, it had adrafinil in there, which is really a modafinil. It's a stimulant. Modafinil is actually a legal stimulant, or it's a prescription drug. It had DMAA, dimethylamylamine, and it had SARMs in it. So you never know what you're going to get when you see these very, very creative labeling on products. You have to really beware. Here's another one that we tested, natural strength. And if you look at the label, it has 5-alpha hydroxylaxogenin and carbapol. Carbapol, I have no idea what it is, and I don't imagine maybe the pharmacologist or who is in the room might know what it is, but I don't really know what it is. And yet here it is in a dietary supplement. It says 65 milligrams. Now, it also has a very interesting label because it tells you to be sure you take it with something that will boost your liver. It says, we suggest the use of a PCT and liver cleanser after use of this product. And it talks about cycling. So we analyze that, and what's in red are all of the different either pro-hormones or anabolic steroids that are in the product. And I think what's really of grave concern is that it actually had almost 30 milligrams of a steroid that is hepatotoxic. So again, these are things that you can buy just about anywhere. Okay, one other one, I think XXX. This is another one that's really quite interesting. And if you look at the label here, I'll blow it up, you can see it has 2-amino-isoheptane, and they claim it's an herbal. Well, it's not an herbal. It's actually a drug. It was called Octodrin, and yet here it is in dietary supplements. And I don't think, so the other thing is we were talking about piperine this morning. That's in all sorts of dietary supplements. We see it all the time, and it's of concern to us, but we don't really know what to do about these things. So that one was analyzed as well, and it had 66 milligrams of DMAA, and that could have killed somebody. It also had a little bit of anabolic agents and some ostarine, although it was trace. But again, it contains quite a number of things that aren't on the label, and it didn't even contain the 2-amino-isoheptane. So here's another one that we'll just look at briefly. What's in this one? So it's called NutriShed. And when we analyzed that, we found a selective estrogen receptor modulator. And there's the name of it. It's actually on the label. And if you look at what it is, it's called a potent suicide aromatase inhibitor. So it irreversibly binds to aromatase. So what it does is it increases testosterone by limiting the conversion to estrogen. But these are all now being found in dietary supplements as well. So unfortunately, I kind of live on the dark side of dietary supplements, but it's something that the consumer should be aware of because not everything out there is clean. So some of the other dietary supplement efforts that we have going on research-wise there's a study that we did on calcium and vitamin D, so that's a nice thing to look at for bone and health immunity. We have an algorithm that we're trying to test to see whether you could use it in the general population, either as a healthcare professional or possibly an individual, that they can take the 7 little questions and look at their label and answer the 7 questions and get a score, and then possibly say safe or go, no go. So we're working on that. That's going to be very simple, but hopefully useful to the consumer or to the healthcare provider. And then we also have some cell culture studies going on where we're looking at particular ingredients and how they may protect against heat. I would say heat illness, but heat tolerance in cell cultures that potentially could at some point translate to a human study. So what are we doing? So I mentioned Operation Supplement Safety. Operation Supplement Safety is our way of trying to educate all service members, leaders, providers, and the warfighters about dietary supplements. And we have had our website for a number of years. We've just migrated it at the end of February this year to an easier URL, opss.org. And it was actually mandated back in 2012 when there were a couple of deaths from people taking products that contained DMAA. And it's really supposed to provide science-based information, tools for safe selection, and it's really for all the members of our community. So family members, leaders, whatever. And this is just a screenshot of the website, and you can see that we have two different, let's see if I could, is that? We have ops for warfighters and families, and then ops for providers and leaders. Depending on where you are, you'll see different information. And so this one, we're on the ops for warfighters and families. Then if you go down there, we have the FDA tainted list that we'll update, and it has all sorts of information. We have a lot of quick links, whoops. And then we also have a little module called Get the Scoop on Supplements, Realize, Recognize, and Reduce Your Risk. It's about a 30-minute interactive module that is for the consumer or for the warfighter so that they can learn a little bit about dietary supplements. There's a nice little, very short video that's kind of a cartoon that shows some really cute, in a cute way, how to select safe supplements. We have a lot on fitness and performance. We have our ops high-risk list, which we'll go over. So there's lots of different information. We have frequently asked questions, and we kind of update those on a regular basis. This is just a selection of some of our more recent ones. And then we go over to our providers and leaders, and we've got lots of multimedia and the like. And then you can also see up at the top it says Ask the Expert. You can go in and ask the expert, or you can report an adverse event. We report adverse events through Natural Medicine Watch. There's a form for asking the expert. And if you'll see up here too, we have a link to our other government resources on dietary supplements. And then you can go to, everybody has access to natural medicine through our portal. And then talks about all of our different partners. And of course, Office of Dietary Supplements at NIH is one of our great partners. The United States Anti-Doping Agency, again, the government resources. We have an FAQ on SARMs. We also have a list of SARMs, all the ones that we've identified in dietary supplements, and we try to keep that up to date. You can see there's a list that's downloadable. It's a little bit scary, but we do offer that to our service members and anybody else who wants to come. We also have a list of stimulants that are found, legal stimulants that are found in supplements for people who want to look at it or if they want to check and see what's in their supplement. So we try to provide an array of information. We are also one of the ones that maintain a list of what products contain DMAA. I know the FDA kind of relies on us to do that. And we try to keep it up to date, although it's very difficult. And I'm sure you can imagine when you've got maybe 90,000 products out there, they come on and go off the market and people reformulate. But we try to keep it as up to date as possible. Again, we have, as I said, educational materials. We've got handouts on SARMs. There's the little video that I mentioned to you, our algorithm, an app for our high-risk list. Our high-risk list we do in collaboration with USADA. You go in there and you have to type in your email, and then you can go in and see what products are on the high-risk list. A lot of these come from our testing program. And then there are also links back to our website for information on those particular topics for anabolic steroids, stimulants, and the like. And I told you about the app. So I know I'm getting close to my time. So I hope that I've shown you that there's some great dietary supplements out there. There's also some out there that really you have to be aware of. And we, within the Department of Defense, have to be very wary and try to do everything we possibly can to help maintain force health protection and the readiness of our service members. Stacking is a problem. We know that adulteration is not uncommon, and we are really trying to improve adverse event reporting, and we think that Operation Supplement Safety is really a very useful tool for everybody within the Department of Defense. So I want to acknowledge a number of people, some of them who are in the room, Dr. Becky Costello, Dr. Paul Coates, and others who have certainly been our partners in this. And then I'll thank you very much. So is there time for a couple of questions? Any questions from the people? Yes?
I have a question about the app itself. Is it used exactly like the webpage where they can just go in, put the supplement, and it'll tell you the number system from 0 to 10?
Oh, I'm sorry, I didn't hear the question.
On the OPSS, you guys used to have it so that when you put in the supplement, it used to do a risk assessment from 0 to 10. Does the app show that same thing?
The risk assessment from, it's 1 to 10 is in natural medicine. They have a 1 to 10.
Is that connected to your guys'
That is,
app?
we have an ops app with them, but the high-risk list does not rate anything. They are just supplements that that have been identified as being really high risk. So there's 2 apps, the ops app, which goes to natural medicine, and then the high-risk list app, which goes to USADA for the high-risk list.
Okay, and then I had a couple of other things. One was, you said DoD-wide, there's nothing on SARMs, but in the SOF community, if there's any SOF people in here, SOCOM does have a policy that SARMs are banned for you guys.
They're all banned, but you have no way to, to hold them accountable.
See what they are. And then my other one was, how do active duty people come to you for research if they want to?
Call us.
Okay, thank you.
You've got my email. Any other questions? Okay, thank you.